Hello everyone, welcome back. Today we will discuss osteonecrosis, also called avascular necrosis. This is an important condition to understand in clinical practice and exams. Let's get started with the definition. Osteonecrosis means bone death caused by a loss of blood supply without proper circulation. Bone cells die, which eventually leads to collapse of the bone structure and joint dysfunction. The common sites. The most common site is the femoral head. Other affected sites include the head of the second metatarsal bone, femoral condyles of the knee, the lunate in the wrist, and the talus in the ankle. The weight-bearing bones are especially at risk. The causes can be divided into two main groups: traumatic causes, such as femoral neck fractures, or hip dislocations, where blood vessels are directly damaged. Non-traumatic causes, including long-term corticosteroid use, which is the most common non-traumatic cause, excessive alcohol intake, sickle cell disease, decompression sickness, caisson disease, radiation or chemotherapy, and sometimes the cause is idiopathic. Now, what's the pathophysiology? The central problem is ischemia. When blood flow stops, osteocytes and marrow cells die. Over time, the bone becomes weak. The articular surface collapses and secondary osteoarthritis develops. Clinical features: the main symptom is pain, usually in the hip or knee. The pain worsens with weight bearing and improves with rest. In hip osteonecrosis, loss of internal rotation is often the earliest clinical sign. The imaging X-rays of the hip joint may look normal early, but later show osteolytic changes, sclerotic changes, fragmentation, subchondral fractures or crescent sign, and collapse with deformity of the femoral head. MRI is the most sensitive investigation, which can detect early disease before X-ray changes appear. CT scans are useful to assess bone structure, the osteolytic changes, and the extent of collapse. Bone scans may show either cold or hot spots, depending on the stage of the disease. Management in early disease: treatment includes restricted weight-bearing, bisphosphonates, or core decompression to relieve pressure and improve blood flow. In advanced stages, joint-preserving procedures may not be effective, and total joint replacement is usually required, especially in the hip. In conclusion, osteonecrosis is bone death due to loss of blood supply, most often affecting the hip. Early recognition with MRI is essential to prevent collapse and long-term disability. Thank you for watching till the end. See you in the next video.